Thank you for joining today's lecture on advanced topics in microbiology and infectious diseases. In this session, we will delve into various aspects of sexually transmitted infections, STIs, and explore the intricate molecular mechanisms, diagnostic techniques, treatment strategies, and preventive measures associated with these diseases. Our goal is to broaden our understanding of the complexities surrounding STIs and equip ourselves with the knowledge to better manage and prevent their spread. Chlamydia trachomatis is a bacteria causing sexually transmitted infections and trachoma. It uses a secretion system to manipulate host cells and forms inclusions for replication. T cells and innate immune factors are involved in immune responses. Insights into host pathogen interactions inform treatment and prevention strategies. Neisseria gonorrhea, the bacteria responsible for gonorrhea, is increasingly becoming resistant to antibiotics. This resistance is caused by genetic factors, such as the production of enzymes that break down antibiotics and mutations in proteins targeted by antibiotics. Studying the prevalence and mechanisms of resistance is important for developing effective treatments and preventing the spread of drug-resistant gonorrhea. Neurosyphilis involves invasion of the central nervous system by Treponema pallidum, the bacterium behind syphilis. Diagnosis relies on CSF abnormalities and neuroimaging. Treatment depends on disease stage, typically with penicillin-based regimens. In this section, we will discuss the use of molecular diagnostic techniques, such as PCR and nucleic acid sequencing, for detecting and identifying viral STDs. We will explore the challenges in assay design, result interpretation, and emerging technologies in this area. Hepatitis C virus, HCV, infection is a significant health concern worldwide, leading to chronic liver disease. This video will explore the complex interaction between HCV and the immune response, the role of viral replication and genetics, and the impact of new antiviral drugs on disease progression. Prevention strategies will also be discussed. While viral STDs often take the spotlight, it is crucial not to overlook the less common or atypical bacterial and protozoal STDs. Mycoplasma genitalium, Ureaplasma ureolyticum, and Trichomonas vaginalis are among the notable non-viral pathogens associated with genital infections. This topic will explore their epidemiology, clinical presentation, diagnostic challenges, and available treatment options. Emphasis will be placed on recognizing the long-term consequences of untreated infections and the importance of accurate diagnosis. The human immunodeficiency virus, HIV, remains a global health crisis, with millions affected worldwide. Understanding the immunopathogenesis of HIV/AIDS is paramount for developing effective therapies and prevention strategies. This topic will delve into the complex interplay between the virus and the host immune system, including viral immune evasion mechanisms, chronic immune activation, and the gradual depletion of CD4+ T cells. Insight into these mechanisms will help in developing novel antiretroviral therapies and improving patient outcomes. Genital herpes, primarily caused by herpes simplex virus, HSV, presents diagnostic challenges due to its fluctuating clinical manifestations and variations in viral shedding. This topic will focus on advanced diagnostic techniques used to confirm herpes infections, including viral culture, antigen detection assays, and serological tests. The interpretation of test results in different clinical scenarios, such as primary infections versus recurrent episodes, will be discussed to aid in accurate diagnosis and management decisions. Maternal syphilis can have devastating effects on the developing fetus, resulting in congenital syphilis. Understanding the pathogenesis, clinical manifestations, and long-term consequences of this condition is crucial for effective management and prevention. This topic will explore the impact of maternal syphilis on fetal development, prenatal screening techniques, and management strategies aimed at preventing or treating congenital syphilis. Timely diagnosis and appropriate intervention can have a significant impact on reducing the burden of this disease. Human papillomavirus, HPV, infections are responsible for a substantial portion of sexually transmitted cancers, including cervical, anal, and oropharyngeal cancers. This topic will explore the global burden of HPV-related cancers, highlighting prevalence rates, risk factors, and the impact of HPV vaccination on preventing these malignancies. We will also discuss challenges related to the implementation of HPV vaccination programs, including vaccine hesitancy and healthcare access disparities. Sexually transmitted diseases are influenced by a myriad of socioeconomic factors, behavioral practices, and cultural norms. This topic will analyze how these determinants impact the transmission dynamics of STDs, focusing on sexual networks, stigma, access to healthcare, and targeted health promotion strategies. Understanding these aspects will aid in developing comprehensive prevention and control programs tailored to different populations and societal contexts. The fight against STDs requires innovative approaches beyond regular screening and treatment. This topic will explore cutting-edge strategies for STD prevention and control, such as the use of microbicides, pre-exposure prophylaxis, PrEP, and the ongoing efforts in developing new vaccines. Discussing the potential impact of these strategies on reducing the global burden of STDs will provide insights into the future direction of STD prevention programs. Based on the given context, considering the audience of medical students, the following conclusion is presented. In summary, this lecture has covered the important aspects of sexually transmitted infections, STIs, including their causes, diagnosis, treatment, and prevention. By applying this knowledge, healthcare professionals can effectively address the global challenge of STIs.